What separates your program from other programs that are out there? I think that, everybody makes these claims, and so I guess I'm just curious, like, what are the big differences there?
The word programs is bastardized. Because we talk to people on the phone every day, and people tell us, I've been through programs or I'm looking at 3 or 4 other programs. I will tell you, I love asking details about that, because what exactly do you mean by programs? Because I have not seen yet a comprehensive root cause approach to autoimmunity anywhere in the world like we do, period. So when I dig deeper, programs to people will mean I went through a supplement regime with a doctor, or I went through certain elimination diets with me. I went through a liver detox protocol with somebody like that. That's not a program. That's a comprehensive solution for autoimmunity. So the word programs mean nothing to me. It really is who the heck in the world has the education, the coaching, and the history, and the wisdom, and the background, and the experience to be able to deliver something that's this comprehensive over a 2-month time frame. There's nobody else doing this in the world. So I'm 100% confident about that, 100% transparent about that we're the only program that's really doing that. I'm the only MD, functional MD, that's doing that.
And so it's, in a way, it's kind of like revolutionary. Like, in what ways is this revolutionary? In what ways is it different? I mean, you kind of I've heard you talk about the kind of like the pods, the mastermind coaching, nutritionists being involved.
Yeah. So if you guys haven't watched the 5 pillars of Transform, there really are some common root causes that are triggering autoimmunity. And I cover that in my training called the 5 pillars of Transform. If you want more information on that, type in the chat 5 pillars of Transform and give me one symptom or diagnosis you have, and that'd be awesome. But I really go into detail, like there really are certain areas, and it's comprehensive. When you look at it, I'm not going to list all of it. I'm not going to give that all away, because I want you to actually watch the training, because there's so much depth to it. When I discovered that you actually cover these 5 areas, right? And these 5 areas really require personalized data. So the problem is a lot of people Google the shit out of things, and there's tons of generalized advice that's personalized to nobody. So really importantly is, yes, here's the protocol with these 5 areas, but what about your own personal data that's provided to insert into each piece of this pie?
Right.
So then you know how the hell each section applies to you personally, so that you have a solution for you. It's personalization is the most important thing around these 5 pillars, is really key. And that's just the what we do, but the how we do it is, okay, who the heck is using your own personalized data? Who the heck is doing education around this? Seriously, there's about 3 to 4 hours of educational video modules that you watch on your own time. And then who the heck is providing hours of live coaching in small group where you are answering these questions and asking these questions back and forth with me? So I'm training you and others how to think like me. I actually tell people who join our program on the first orientation call, I say, if I do my job right, which I always do, by the end of this, you're going to know how to think like me. I'm not here so you can learn to run to another MD or another doctor and beg for an answer. I'm here to teach you how to come up with 99% of these answers on your own, like this, at the end of this time. What MD is teaching other people, patients or clients, how to think like them? What MD even knows how to think around autoimmunity? So for me, that's really unique. How can you have all these answers around how to approach this? And I'm here to actually teach you how to be the master to do this, rather than, oh, you're dependent on me for answers for the rest of your life. Come back just to me over and over again. I don't teach a dependency model. I'm absolutely teaching a self-trust, educational, self-piloting model of turning around your health, which is why it's revolutionary and different.
So you're telling me that me going on WebMD and diagnosing myself doesn't work anymore?
Yeah, that's Jockage. Yeah, that's Jockage.
Right.